Hello, my name is Ricardo Macapagal, and I'm a third semester student in Los Angeles Southwest College. My group and I will be discussing about communicable diseases in children. In this video, we'll break down to different types of diseases and we'll individually talk about their infectious agents, transmissions, signs and symptoms, and treatments and complications. To start off, what are communicable diseases? To simply define it, it is basically any disease that passes between people or animals. People sometimes refer to communicable disease as infectious or transmissible from pathogens such as bacteria, fungi, viruses, and protists. To start off the list, I will be talking about exanthem sibitum, mumps, and measles. Exanthem sibitum is also known as Rosalina infantum, whose agent is human herpes virus type 6. The source is possibly acquired from saliva or healthy adults where the entry comes through nasal, buccal, or conjunctival mucosa. Its transmission is year-round, where it's virtually limited to children less than 3 years of age, but peak age is 6 to 15 months. The incubation period is usually 5 to 15 days, and the period of communicability is unknown. Some clinical manifestations would be persistent high fever greater than 39 degrees Celsius and 103 degrees Fahrenheit for 3 to 7 days, bulging fontanelles, precipitous drops in fever to normal with appearance of rash-associated signs and symptoms which include flames, pharynx, cough, and coryza. Some therapeutic managements for this disease are nonspecific, but antipyretics are used to control fever. Complications include recurrent febrile seizures, encephalitis, and hepatitis. For nursing care, use standard precautions and teach parent measures for lowering temperature, antipyretic drugs, and understand specific dosage of pyretics to prevent accidental overdose. If your child is prone to seizures, discuss appropriate precautions and possibly of recurrent febrile seizures. Next, communicable disease in mumps whose agent comes from paroxysmal virus. The source comes from saliva or infectious person and is transmitted by direct contact with droplet spreads from an infected person. The incubation period is 14 to 21 days, and period of communicability is immediately before and after swelling begins. Clinical manifestations include the prodromal stage, such as a fever, headache, malaise, and anorexia for 24 hours, followed by earache that is aggravated by chewing. By the third day, parotid glands enlarge and reaches maximum size in 1 to 3 days, accompanied by pain and tenderness. And therapeutic management include childhood immunizations, and the symptoms can be treated with analgesics for pain and antipyretics for fever. IV fluids for a child who refuses to drink or vomit because of meningoencephalitis, and complications such as sensorineural deafness, post-infectious encephalitis, myocarditis, arthritis, hepatitis, and pancreatitis. For nursing care, you want to maintain isolation during period of communicability, institute droplets and contact precaution during hospital stay, encourage rest and decrease activity during prodromal phase until swelling subsides, and give analgesics for pain, encourage fluids and soft bland foods to avoid chewing. Apply hot or cold compresses to neck, whichever is more comfortable, and to relieve orchitis, provide warmth, local support with tight-fitting underpants. Finally, for my part, I'll be talking about measles or rubella. The agent is a virus and the source is from the respiratory tract secretions, blood, and urine of infected people. It is transmitted usually by direct contact with droplets of the infected persons, primarily in the winter. The incubation period is 10 to 20 days and the period of communicability is from 4 days before and to 5 days after a rash appears. Clinical manifestations include fever and malaise, followed in 24 hours by coryza, cough, conjunctivitis, and Colpix spots. A rash appears 3 to 4 days after onset of prodromal stage. Constitutional signs and symptoms include anorexia, abdominal pain, malaise, and generalized lymphadenopathy. Therapeutic management would be prevent with immunization. Supportive treatment includes bed rest during febrile period, antibiotics, and antipyretics. Complications include otitis media, pneumonia, obstructive laryngitis, and laryngotracheitis. It is advised to administer vitamin A for these children. For nursing care management, you want to maintain isolation until the 5th day of rash, and if the child is hospitalized, institute airborne precautions. Encourage rest during prodromal stage, take antipyretics for fever, and for eye care, dim lights if photophobia is present, and clean eyelids with warm saline solution to remove secretion of crusts, and keep children from rubbing their eyes. For coryza cough, use cool mist vaporizer and protect skin around nares with layers of petroleum, and encourage fluids and soft bland foods. And finally, you want to keep skin and keep them clean and use tepid baths as necessary.
Hi, I'm Lana, and I'm going to be talking about chickenpox, diphtheria, Erythema infectiosum, also known as fifth disease. Chickenpox is caused by the virus varicella zoster virus. It is an airborne disease which spreads easily from one person to the next through the coughs and sneezes of an infected person. It is contagious from 1 to 2 days before the rash appears until all the lesions have crusted over. It can also spread through contact with the blisters. Itchy blister rash caused by chickenpox appears 10 to 21 days after exposure to the virus and lasts 5 to 10 days. Other signs and symptoms appear 1 to 2 days before the rash: fever, loss of appetite, headache, tiredness, and general feeling of being unwell, also known as malaise. Once the rash appears, it goes through 3 phases: raised pink-red bumps, known as papules, small fluid-filled blisters, known as vesicles, and then crescent scabs. The rash can cover the entire body. In healthy children, chickenpox typically needs no medical treatment. Your doctor may prescribe an antihistamine to relieve itching. For high-risk children, an antiviral drug might be prescribed, such as acyclovir. To help the ease and symptoms of the following can help. Avoid scratching, so put gloves and trim the nails of your kids. Cold bath and baking soda. Calamine lotion, Tylenol for fever, but remember to call your doctor if the fever lasts longer than 4 days and higher than 102 degrees. Complications with chickenpox can be dehydration, pneumonia, bacterial infections of the skin, and inflammation of the brain. The best prevention is the vaccine, the chickenpox varicella vaccine. Diphtheria. Diphtheria is a serious infection caused by the bacteria Corynebacterium diphtheria. It usually affects the mucous membrane of the nose and throat and is spread by airborne droplets, the mist from an infected person's cough or sneeze. Usually begins 2 to 5 days after being infected. A thick gray membrane covering the throat and tonsils occur. Sore throat with hoarseness can occur. Swollen glands in the neck, difficult or rapid breathing, nasal discharge, fever and chills, and general feeling of being unwell. There's the malaise again. In some people, the illness is mild and others might not have any signs or symptoms. Those who are unaware they are infected are known as carriers of diphtheria. They can spread the infection without being sick themselves. Diphtheria is a serious illness and doctors treat it immediately. Treatments include antibiotics such as penicillin, or an antitoxin may be given. Diphtheria toxin may spread through the bloodstream, causing inflammation of the heart. Best prevention is childhood immunization. Diphtheria is one of the 3 vaccines included in the DTaP vaccine. Erythema infectiosum, also known as fifth disease. Fifth disease is a mild rash illness caused by the parvovirus B19, sometimes called slap cheek disease because of the distinct face rash. Common in school-age children, it is spread through respiratory secretions such as saliva and nasal mucus, which is spread through coughs and sneezes and hand-to-hand contact. Blood and blood products can also spread the disease. Children are most contagious when they feel like they have a cold, which is before they get the rash. Early signs and symptoms are fever, upset stomach, headache, runny nose. Several days after the early symptoms, a bright red rash may appear on both cheeks. This also could spread to the arms, trunks, thighs, and buttocks. Self-care treatment at home is generally sufficient. Rest, plenty of fluids, Tylenol may help relieve fever. And remember, once the rash appears, your child is no longer contagious. Fifth disease can cause serious complications for children with anemia, especially sickle cell anemia. Always consult with your doctor if you have any concerns. There is no vaccine to prevent this infection, but once you become infected with parvovirus, you get lifelong immunity. However, good hand hygiene, not touching your face, and avoiding people who are ill can help prevent your child from getting it.
Hello, my name is Samuel. I'll be talking about scarlet fever and COVID-19. Scarlet fever is a bacterial infection that develops in some people who have strep throat. It is caused by group A beta hemolytic streptococci. It is spread by nose and mouth secretions from infected individuals. Signs and symptoms of scarlet fever include sore throat and painful swallowing, fever above 101F, flushed face, enlarged lymph nodes, strawberry red tongue, and red rash throughout the body. Scarlet fever is diagnosed using a throat swab and culture. This is done because other conditions have similar symptoms. If left untreated, the infection can spread to other organs and could lead to death. Scarlet fever is treated using antibiotics. It is important to finish all of the antibiotics so the infection does not reemerge. There is no vaccine for scarlet fever. Prevention measures include hand washing, avoiding sharing cups and utensils, covering your nose and mouth when you sneeze and cough. COVID-19 is also referred to as coronavirus, COVID, or the Rona. It is caused by a virus called SARS-CoV-2. It is highly contagious and is thought to be spread through respiratory droplets when an infected person talks, coughs, or sneezes. Scientists are still studying exactly how COVID-19 spreads, but it is possible these droplets become airborne. The main risk factor for contracting COVID-19 is close contact of 6 feet or less with an infected individual. Some people infected with COVID-19 don't always show symptoms, yet can still pass on the virus. Signs and symptoms of COVID-19 include fever, cough, fatigue, muscle aches, chills, shortness of breath, runny nose, headache, and chest pain. Individuals with chest pain or pressure, difficulty breathing, coughing, confusion, inability to stay awake, or blue face or lips should seek emergency medical care. As of November 2020, over 260,000 Americans have died of COVID-19. Children are more likely to have a mild case of COVID-19. Older adults are more likely to suffer severe cases and death. Persons with certain underlying health conditions are more likely to suffer complications and death. For severe cases of COVID-19, hospitalization is necessary. For mild cases, isolation at home so as not to infect others is required. Rest, fluids, cough suppressant medication, and fever reducers such as acetaminophen and ibuprofen. COVID-19 prevention. Avoid contact with infected individuals. Avoid crowds and gatherings. Wear a mask. Avoid others who are not wearing a mask. And wash your hands often. If you are experiencing symptoms of COVID-19 or think you may have been exposed, get tested. Free testing is available in the LA area as of November 2020. A link will be in the comments. Thank you for watching.
Hi, my name is Chioma Nancy Nwadeba. I'm a third semester nursing student of Los Angeles Southwest College. I'm here to talk about communicable disease, and I'll be talking about two communicable diseases. The first one going to be polio, and the second one going to be rubella. The communicable disease I'm going to be talking about is poliomyelitis. Polio is an infectious disorder that affect the nervous system. It is caused by the polio virus. The virus spread by direct contact. It is also highly contagious and it can cause temporary or permanent paralysis. Mode of transmission. Polio mainly affects children under the age of 5 and it spreads by fecal oral transmission, which means that the virus usually enters the body through contaminated food and water that goes in the mouth. An infected person may spread the virus to others immediately before and about 1 to 2 weeks after symptoms appear. Signs and symptoms of poliomyelitis are as follows: sore throat, fever, vomiting, muscle spasm or tenderness, fatigue, back and neck pain. Severe symptoms include loss of muscle reflex, floppy lip, which are usually worse on one side of the body, extreme and severe muscle pain and spasm. Once a person has polio and becomes paralyzed, there is no cure and it could be potentially deadly. The only thing that can be done to prevent poliomyelitis is vaccination. There are two kinds of vaccination, is oral polio vaccine and inactivated poliovirus vaccine. Prevention for poliomyelitis includes health promotion through environmental sanitation, health education. The greater risk is when traveling to area where polio is common. Make sure you are vaccinated before you travel to this area. Lastly, I'm going to talk about complications of poliomyelitis. Possible complications. Health problems that may result from polio are as follows. 1. Aspiration pneumonia, core pulmonal, lack of movement, lung problem, urinary tract infection, myocarditis, paralytic illness, shock, permanent muscle paralysis, disability, and deformity. Now I'm going to talk about rubella. German measles, also known as rubella, is caused by the rubella virus. It is said to be a viral infection that causes a red rash on the body. Aside from the rash, people with German measles usually have a fever and swollen lymph nodes. The infection can spread from person to person through contact with droplets when an infected person sneeze or cough. This means that you can get German measles if you touch your mouth, nose, or eye after touching something that has droplets from an infected person on it. You may also get German measles by sharing food or drink with someone who is infected. Mode of transmission of rubella. Rubella is spread when an infected person cough and sneeze. Also, if a woman is infected with rubella while she's pregnant, she can pass it to her developing baby by means of placenta, and this can cause serious harm to the baby. Signs and symptoms of rubella. In children, rubella is usually mild with few noticeable symptoms. For children who do have symptoms, a red rash is typically the first sign. The rash generally first appear on the face and then spread to the rest of the body and last about 3 days. Other symptoms that may occur 1 to 5 days before the rash appear include fever and headache, heart color pain, flu-like symptoms like running nose, cough and sneezing, lack of appetite, red eye, and fatigue. Most adults who get rubella usually have a mild illness with low-grade fever, sore throat, and a rash that starts on the face and spread to the rest of the body. Some adults may also have a headache, pink eye, and general comfort from the rash before the rash appears. About 25 to 50% of adults infected with rubella will not experience any symptoms. Treatment of rubella: there is no specific medicine that treats rubella or make the disease go away faster. In many cases, symptoms are mild. For other mild symptoms can be managed with bed rest and medicine for fever, such as acetaminophen, Tylenol. Prevention of rubella: the best way to prevent the rubella virus is to get vaccinated. If you don't know whether you have been vaccinated for German measles, it's important for you to test your immunity, especially if you are a woman of childbearing age. Attend an educational facility, work in a medical facility or school. Plan to travel to a country that does not offer immunization against rubella. Lastly, I'm going to talk about the complications of rubella. They are as follows: heart problem, loss of hearing and eyesight, intellectual disability, and liver and spleen damage. In rare cases, rubella can cause more serious health problems like brain infection or swelling and bleeding problems.